Hello, and welcome to the webinar entitled Medicaid Billing for School Psychologists and Social Workers. I'm going to go ahead and mute everyone as we get started here. If you have a question throughout the presentation and you need to unmute yourself, feel free to do so. But I'm going to start off just with everybody muted. And also to let everyone know that this webinar is being recorded so we can save this. And if you know folks who want to come back and review it, they will be able to access it at a later date. So my name is Kim Moore. I currently serve as the IAASE Medicaid Committee Chair, and I also work for the Embrace Education Company. I'm a retired director of special education, and I have had the privilege of working with school psychologists and social workers over the years. And I genuinely appreciate the fact that you guys have a lot of things going on with large caseloads and managing crisis and all the evaluations that come up and transfer in. I just really appreciate you guys taking your time out today to participate in the webinar and hopefully learn more about the Medicaid billing process in Illinois. The intent of this presentation is to provide you with a general overview. So you're going to get a big picture overview, not just the fee-for-service school-based type, but the overall admin outreach. So you just understand big picture in Illinois, kind of how the whole Medicaid billing structure works. But due to the fact that a lot of Medicaid vendors, so each district and cooperative, they contract with a Medicaid vendor to manage their fee-for-service Medicaid claims. And every vendor is very different. So one vendor may have ideas on a certain approach to how to manage things, and a different vendor would totally give a totally different approach. So as we're going through the presentation, I really want to encourage you guys to write down some questions you may have that's specific to your Medicaid process within your system. And then you can talk with your district administration, and they can work with your Medicaid vendor to get you some answers that you would need for that. So I just want to make sure that there's that understanding there that each Medicaid vendor is very different. But there are some general overview and some general guidelines that we'll definitely share today. The things that are in the webinar have come right from the U200 manual. That is the manual that manages the school-based services in Illinois for Medicaid billing. So you'll see those throughout the presentation, but I just want to let you know about it will be more challenging to answer specific questions where I'll have to redirect to the contacting your Medicaid vendor. So that being said, we'll go ahead and get started. One of the things I wanted to first start off with before we jump into all the craziness of Medicaid and all the technicalness, I just like, since I have an audience of school psychologists and social workers, and you folks are the frontline people with parents all the time. So I really want to start off by helping you guys understand the importance of Medicaid, not just from the billing perspective that I know you manage day to day with all these other things that you manage. But there was a study done that clearly shows the benefits for kids who are connected with health coverage through Medicaid. They often do better in school. They miss fewer days due to injury or illness. They're more likely to finish high school, attend college, and graduate from college, have fewer emergency room visits and hospitalizations as adults, and earn more as adults. So as we're going through this presentation, be thinking if there's anything that comes up that you can have a moment to talk with families or to get them connected if there is that need. And then you can focus your discussions relating to Medicaid, you know, when you talk to your district staff and your community representatives about Medicaid, you'll be able to have a different perspective and present it from that positive outcome for kids versus it just being about finances. So I really like to show this for direct service providers and helping you just have that extra lens of what Medicaid really is about. It's about getting kids covered with good health coverage so they can have those positive outcomes. So now I put that in there. Now we're going to start with the agenda, which starts right away with learning about the revenue that is involved with Medicaid. Okay, so today we're going to just take a look at types of Medicaid-based revenue. There are two types in Illinois. Every state has its own plan. It's like with special education. No IEP is the same when you go from state to state. It's the same with Medicaid. So Illinois contracts with the federal government to manage Medicaid revenues. And the two types that they manage is the administrative outreach and then the fee for service. And a lot of our program today is going to focus on the fee for service. But I want to cover this administrative outreach so you guys understand how that fits in the big picture with Medicaid. And then we'll look at some resources that you guys can have and we'll share with you to hopefully help in the future if you have those needs. So moving forward, I am just going to start off with the two types of Medicaid funding. This is the Medicaid administrative claiming and then the fee for service. And this is, again, is where most of us are going to spend a lot of our time as providers. But just having the idea of what's going on with this Medicaid administrative claiming. So we'll look at each of those separately and see how that impacts you guys. So for the Medicaid administrative claiming option, that's a program that allows schools to claim federal Medicaid reimbursement for activities related to the administration of the state's Medicaid plan. And this includes costs associated with identifying and enrolling populations in need of Medicaid services. So that's an important piece of that administrative claiming, linking individuals and families to service providers, and then coordinating and monitoring health-related services. So this is all that administrative type stuff that goes on behind the scenes. And so they try to capture that as based on each district's individual expenses. You know, how can they reimburse districts and cooperatives for that piece of it? So part of that administrative outreach is the outreach piece. And this is an amazing resource. So especially social worker and psychologists having knowledge of this. This is the website in Illinois. They've done an amazing job with simplifying this for parents. So if you come across a parent that is in need or through any of these types of, whether it be preschool screenings, parent-teacher conferences, brochures in the office, there's things you can do to help advertise that this is out there. And what this website is the gatekeeper in the state of Illinois for families to access Medicaid. This is where they will go to apply for services all across the whole state. And it's a very user-friendly website. It really walks parents through that. I also have, if you're in a situation where you are district personnel that does assist parents with explaining the application process, assisting them with the application and submitting the application, I put here, this is a step-by-step, it's a PDF, it's great, that you can give parents and say, this is the website, follow these steps that'll walk you through. So it really, really is a great resource. But just for all of you to have this information that this is available, and this is how all families get connected to Medicaid services is through this website here. So hopefully that will be a good resource if you're in that position and you need to explain things or help them get connected, and even assisting them through the process as well. You'll have more resources available to do so. So that's the first part of that admin outreach. The second part involves capturing costs. So you have the outreach to parents and, and your families, and now the other part to that is capturing costs. And I know most of you are very familiar with the random moment time study, those emails that you get, and they want you to explain specifically what you were doing at that specific time. Well, the purpose of that is they're trying to gather information on the specific activities, like administrative type activities that you're doing that can be reimbursed to the district or cooperative. So just the general overview for that is Healthcare and Family Services. They're the agency that manages the Illinois State Medicaid Plan for school-based services. So they contract with a company called Fairbanks to manage their administrative outreach in Illinois. So every school district and cooperative public school district in Illinois goes through the same process. So Fairbanks manages those contracts for the state, and they gather all the district employment and financial information. They do that quarterly. So somebody in your business office at the district or cooperative level is filling that out for Fairbanks. And they're sending that information back to them so they have that financial data to be able to calculate some rates. And then Fairbanks sets up that random moment time study. And they randomly select staff from the district, and they send the emails. And for those of you who have gotten your random moment time study, and may have, I'm not saying anybody has it, may have ignored it, they're pretty forceful. They're going to be sending you email to get that completed. And it's really good for you guys as practitioners to know how important that is. Each district and cooperative, they're required to meet a certain percentage of completion, and it's a high bar. It's, it's very, very close to 100% completion of those random moment time studies. So making sure you follow up on that right away, because that thing is not going away. And submitting that in a timely fashion is really, really important. And then Fairbanks is going to take all that data that you guys submit through your emails, all the financial data that was submitted, and they're going to calculate a claim amount. And then quarterly, they're going to send those funds directly to the districts and cooperatives based on the services that were listed during those random moment time studies. So hopefully that gives you a better idea of what that whole part is about. So that's that Medicaid piece in Illinois, where they're utilizing that random moment time study to collect revenue for those types of administrative services. Now, the part we're most familiar with is this fee for service. So this is the other silo. We have our admin outreach, and now we have our fee for service. So the best way that has always helped me explain and understand this is fee for service. Whenever I think of a question related to what can I bill for, what can I do, I often think, is that student sitting in front of me? So fee for service often lends itself to, it's the cost for that direct medically necessary services that are provided to students who have disabilities. So it's a direct service. So the kids in front of you, whether it's individual or group, that's really fee for service realm. So if you're thinking regarding questions, think, is this a direct service type of thing from a fee for service billing perspective? In Illinois, these are the areas for school-based health services that can be billed to Medicaid for reimbursement. They're listed here. And these services, they're frequently specified as necessary related services in the student's IEP. So that's important to know that when you bill for Medicaid services, there's typically almost always, if not 100% of the time, it's going to be in the IEP. So you're going to have those listed there, how many minutes per week, all of that type of data that would support that claim. And this is the link to that U200 manual. You're going to see some copy and pasting from that. But this is the manual that you can access and read, and it will allow you to look through all the stuff we're going to go over. So if you need some late night reading material, that you can have that. It'll be there for you to access. But I'm specifically for today, we're going to be focusing on school psychologists and social workers. So this information here is specifically for school psychological services, and this was pasted right from the manual, that U200 Medicaid manual for psychological services. So this is for necessary services for the development of the student's IEP or IFSP, or documented in the IEP or IFSP for diagnostic treatment. So these services include, but they're not limited to, so that leaves a lot of gray area. I totally get that. But here's just some basic overall, what's in the manual are activities that can be billed for Medicaid. I want to note here, and this is also the same thing on the school social worker description as well, that they do list here in the manual unscheduled activities for the purpose of resolving an immediate crisis situation. There's a lot of folks who don't know that. Honestly, it was a while before I administratively, when I was administrator, even caught on to that component, but it is there. So for example, let's say a student is receiving 30 minutes a week for counseling by a school psychologist, and then on the fourth week, they get their 30 minutes for that last week, but then the next day they have a significant crisis situation. Maybe there was a restraint involved and it took over an hour or more. That type of a situation, that staff can actually go back and bill for those unscheduled activities for the purpose of resolving an immediate crisis situation. So that's there, and that's a great topic to have a conversation with your district administration and the Medicaid vendor company about how do you document that extra unscheduled activity, those type of things. Again, it's going to vary by Medicaid vendor. So having those, that's a good conversation for that. And these are the professional qualifications for school psychologists, and it also includes psychologist intern. So interns can document and bill for services that they provide to students who are Medicaid eligible. And then the certified person who's overseeing the intern would then review the logs and then approve them. So that is an option as well, and that's listed right here in the manual. The next one is the school social work services. Again, it's right from that U200 manual. This is just pasted in here. This lists all of the services that they can bill for, but again, not limited to. So those are all right there. And here's that note for the unscheduled activities of the purpose of resolving an immediate crisis. So those are there. Hopefully there's no surprises here for folks. That you've been billing and documenting these types of services, but I just wanted you to know that this is the actual description from the manual that you can reference there. Again, professional qualifications, and it also has the social work intern can submit services that they provided, and then they get approval by the certified social worker. So those are those service descriptions and activities that can be billed. Now, the next area that has generated a lot of questions, and this is really coming from the Medicaid committee, the IAASE Medicaid committee. We have multiple people on that committee and their administrators, and they hear from their folks about what are some of the questions that come up from social workers and psychologists regarding documenting billing for Medicaid. One of the big questions that causes quite a bit of confusion is the ICD-10 service code. So how I view this as, it's just Medicaid is a very medically based organization. So the primary role where a lot of their business for Medicaid billing occurs in hospitals and clinic settings, and the school-based services are just a very, very small percentage of the overall Medicaid processing in the state. So, but due to it being very medically based, we have these ICD-10 codes that are required to submit for processing a claim for reimbursement. And this is a link to that database, but there's thousands of them, thousands of codes that you can use when you're submitting claims. Again, your Medicaid vendor can walk you through this. They can help you with this. I just want to say that because they know what this is. This is their wheelhouse. They can help you figure that out. But just a note here that the ICD-10 code may not directly reflect the student's eligibility because they're medically based. And we do a lot of school-based stuff. So sometimes there isn't a nice match, but it should reflect why the staff are providing services to the student. But any questions regarding the ICD-10 code is to really just connect with your district administration and have them work with the vendor to walk through some of those questions. So again, I know there's been some questions about that, but that's definitely one where your Medicaid vendor can be the best resource for you guys. The next area of a lot of questions that were coming in related to service minutes. So how Medicaid calculates this behind the scenes from a financial perspective is one service unit equals 15 minutes. So once you provide 15 minutes, that is one unit. They also provide this information here, and this was pasted right from the manual section, that 7 minutes of face-to-face service must be provided in order to claim the 1 service unit. So just knowing that, so that if you have a question like, oh, I only saw the student for 10 minutes, can I bill for that? Well, you've met the 7-minute threshold, and that would meet that 15-minute service unit requirement. I have this right here again. Check with your Medicaid vendor. Often vendors will have you just document the actual minutes you worked with the student, and then they'll do that translation from minutes to units behind the scenes. So this may not be something that impacts you, but if it has for some folks out there, because they're wondering about this whole service minute thing and how that works. So that's just an explanation about that. Some other questions came up regarding service minutes is, can you log them monthly versus weekly? And that tends to allow for more flexibility versus saying every week we're going to see the student for 30 minutes. Maybe within the month, you're for sure going to see that student for this amount of minutes. So again, that's a question that you can take back to your district administration, and they can work with your Medicaid vendor to see how that would translate. And that would even include how the IEP is filled out and how their data management system where you enter data for Medicaid, how that's structured. So those would be questions you could definitely direct back to those entities. And then there was questions about the claims themselves and what they put in their log. So I actually have a form of a U200 manual of the service log, and the requirements on the next slide I copy and pasted from there, so we'll go over those. The last one regarding the service minutes was related to compensatory minutes. So when do we have to make up minutes? If the student was not there, not present, or the staff was not present, that type of thing. This is definitely going to be something you can talk to your district administration for direction regarding. And every district or cooperative, they're going to have a philosophy about this. To my knowledge, there's nothing set in stone or a regulation outside of the IEP saying these are the minutes that are to be delivered, you know, so many minutes per week or month. But check with your administration on how they want to handle that regarding compensatory, making up minutes, that type of thing. So that really is about as clear as mud, but unfortunately that really is something that you're going to have to check with them at your own individual level. The other thing that is important, again, because school psychologists and social workers, you guys really are sometimes that first touch with the parent. And parental consent is so vital to this whole process. And nobody wants to go through all of the work and document services and be very diligent about it. And then at the end of the day, they can't even, you know, process the claim because they don't have that parental consent. It's just important. I know when it first started, when I was a director, nobody really got this piece. And I remember people trying to explain that form to parents, and we were stumbling around, and it was just crazy. It was a very difficult thing to do. And now it's definitely better. And I know at our cooperative, we just sat down, we role played that form, we practiced that, especially our speech only folks that really weren't in that loop. And we just really had to train on it because we knew the importance of getting that parental consent. And often there was just a disconnect with how it was being explained. But it is a one-time parental consent, and this is an IDEA regulation. So this is important to meet that requirement. And again, as you guys are often those frontline people to work with parents, you're a great resource to make sure that you have that, and that you have that parent signature that yes, they have agreed to the consent. So, and keeping copies of those records is important, but this is vital. Without that parental consent, districts can be exposed to losing out on a lot of claims to be able to capture that reimbursement. All right, so as far as the service record documentation itself, these items are actually taken right from the U200 manual, and this specifically lists the things that need to be included with a Medicaid claim when by a service provider. So it's the very basic student name, date of birth, school, service date, description, how much time you guys were doing, what type of service it was, that medical diagnosis that you code that gets put in there. And then the service practitioner's name and your title and a written or electronic signature for that claim, that service you provided. And then the signature of the service practitioner supervisor if necessary. Again, if you have an intern, that would be provided. Where a lot of questions are coming up, at least from what I hear from the field, from the Medicaid committee folks, is regarding the service description. So this is actually from the U200 manual. This is the log. So if you're going to, handwrite it type of thing, this is what they have in there. And this is the service description right here. And this says the results response case notes must relate to the IEP or IFSP goals and objectives. So that is what the service description says on the manual. Now, you can take that back to your district administration and your Medicaid vendor, and you guys get to have a conversation about that and what that looks like and where that goes in the system and how that's to be reported. But for audit purposes, if there was an audit, they would be looking for this type of information regarding each claim that was submitted for Medicaid reimbursement. Again, that's just from the manual, being very, very general here. And that would be, again, something you can have a conversation with at your district or cooperative level. So the big overview here and where you guys fall in is where first it starts with that direct services provided to a student. And that's where you guys are right there with the students. And then you go in and you document that service information. And typically it's in some electronic type of system where you put the date and you put all that information, how much time, and some service notes that goes in there as well. So that's where your realm is here in this big cycle. But then the big picture is then your Medicaid vendor is going to prepare and submit that claim data to HFS on behalf of the district or cooperative. And then HFS is going to apply all their service rates. Again, they have all of your financial information. Someone at your district or cooperative level is given that every year. They update that. So they're going to decide what claims are eligible because students move on and off of Medicaid frequently, and then what rates are applied. And then they're going to calculate that, and then there's a match amount. So they don't pay the full amount. It's just a match amount. And then they send the reimbursement funds back to the district. So just so you guys know and have that overview, this is where you guys are providing the service and documenting it. And then this is the rest of the cycle that occurs through there. So hopefully that will give you an idea overall about how that whole fee for service works, that structure there with that. All right, the next section is just some website links, and also there's a webinar library if you really want to geek out on Medicaid that you can go check out and watch some webinars. So some resources, again, here's that U200 manual that you can click on, and it gives just a lot of explanation. It's the state Medicaid plan for school-based services. The HFS, Healthcare Family Services website, is here. And again, they manage all of that fee for service that the state Medicaid plan is through them. Here's the school-based health service link on Illinois.gov that specifically focuses on the school-based health services. And we mentioned Fairbanks with the random moment time sampling. So this is their website. If you have any questions or just want to be interested in that, that's the company, the agency that manages that for districts in Illinois. And this is the IDEA regulation document regarding parental consent. If you do some research on that, that's where that's at. And that AID website where you can direct parents to get connected to Medicaid services. So those are all there for you guys for any information that you would need. I also want to note that there are some webinars that we have done in the past, the IAASE Medicaid Committee has. We have the one here for school-based strategies for Medicaid Outreach, and this is really would be awesome for, honestly, psychologists and social workers to check out just some different ideas on how to do outreach with families and try to get them connected to Medicaid services if they have no health services. Medicaid billing for health aids and transportation, and maximizing Medicaid revenue. Now that's a real technical financial one. If you really, really, really want to know a lot about it, you can check that one out as well. So the recordings for these webinars are found on the IAASE website under Member Resources, and they're also on the Embrace website under the blog section. And that's just the embraceeducation.com. And you just click on the blog section. You can scroll down and you'll see some more Medicaid webinars are there. And this is my contact information. Feel free to reach out if you have just some general questions regarding the webinar or Medicaid in general. And just please know any specific types of questions, I'll definitely refer you back to your district administration and their Medicaid vendor, and they'll be able to help you with that. Okay, that's all I have for today. If anybody has any questions and you want to unmute yourself to ask any, feel free to do so. I'll be on here just for a few minutes to see if there's any questions that I can answer. So feel free to do that.